When we want to move our body, we have impulses that come from our brain that send signals down the spinal cord to the nerves that innervate our muscles. And these muscles get a signal to move.
And when we want to stop moving, then the brain stops the signal and the muscle is able to relax. The problem in spasticity is the brain is telling that muscle to contract, to move all of the time.
Spasticity is an abnormal firing of the nerves, and it can happen after a brain injury or a spinal cord injury or certain other neurologic conditions.
And we lose that ability to relax the muscle and to relax the motion.
Because of the muscle tightness, it can cause abnormal positioning of their arms and stiffness in their joints, that their joints, depending on the severity, might not be able to move at all.
Spasticity can be very limiting to functional activities, and of course there's a range of spasticity from very mild to very, very involved.
And so that's why it's so important to have a lot of different experts putting their heads together, both to understand the patient's unique pattern of spasticity, but also how that's functionally impacting them, and come up with treatment plans that will work for them. There's absolutely no cookie-cutter approach to spasticity. We have to treat each patient and their particular patterns of muscle spasticity and their particular goals. Otherwise, we won't get the results that the patients are looking for.
Yale looks at the individual as a whole. It's not just one specialist coming in and looking at that one part of the body.
Usually we'll start with physical or occupational therapy to really work on the muscle range of motion and try and help the muscle relax. And in cases where we really understand the affected muscles and it's not more widespread,
we are able to come up with tentative surgical plans for the patients and then able to test them in real time.
Whether it's nerve blocks or Botox type treatments.
We have a new therapy called cryoneurolysis. We're actually targeting the nerve that innervates the tight muscle and reducing the amount of nerve impulses coming into the muscle.
So we can see the impact that nerve-based procedures would have on the extremity. But it's also amazing because it lets us uncover tightness in the joints or shortness of the muscles, so we can determine if they also need more traditional tendon or joint-based surgery.
So they almost get to see a little bit what surgery would be like. So that is invaluable. And then if you take that the next step, having plastic surgery, nerve surgeon work together with an orthopedic surgeon brings two very different types of training together.
So I'm able to find the nerve branches to some of the muscles when the nerves are branching into tiny filaments and entering the muscle. I'm actually going and treating the spasticity as well by taking away 80% of the nerve fibers to reduce the tone and give it a more normal amount of innervation.
Now what we started doing is combining those methods with what's been done historically, what works for tendon lengthening, joint fusions and things like that,
so that we can target the too much nerve signal and also too short a muscle pathway.
The two heads together actually comes up with a better result for the patient and allows us to do things to maximize their clinical result.
We also have a team of excellent therapists, and in our multidisciplinary clinic, we specifically have an occupational therapist.
A lot of the procedures are getting them into a better position for function, so I'll brace them to make sure that we maintain that, and then after that, we talk about like how to actually use the function.
What about the wrist? The wrist seems much
Yes,
I
it
love
does.
It looks great.
Doing some rehabilitation post-surgery really leads to better outcomes and hopefully that the patient can have lasting results.
Can you break it in so you can touch her? Not arm, not body, just the hand. Yep.
Yeah, look at that.
Yeah.
Adults with spasticity oftentimes have very complicated medical problems. They've had a big stroke or they had a big brain bleed, a spinal cord injury, and there can be so much focus on life and death at the beginning that they get forgotten. But if we can improve their comfort, their extremity function, the ability for folks to help take care of them, it can have a profound impact on them.